with Wisconsin State. We are with the Wisconsin State Laboratory of Hygiene's WisCon Public Sector Consultation Team. And today we're going to be talking to you about work-related asthma. Next slide. So to give a little bit of a background, asthma is considered to be one of the most prevalent work-related lung diseases, according to the American Lung Association. And the National Institute of Occupational Health and Safety, or NIOSH, estimates that more than 2 million people may have work-related asthma. One thing that should be noted is that research has been slightly delayed. Obviously, you can see the 2012 timestamp there. So clearly, this is evidence that more research and work should be done to collect data as it pertains to work-related asthma. So just something to think about as we move throughout this presentation. Additionally, asthma is considered to be a disease that affects your airways, making it hard to breathe. And then when asthma begins to get worse because of a job, healthcare providers may be able to diagnose this as work-related asthma. Work-related asthma includes both occupational asthma and work-exacerbated asthma. Next slide. So work-related asthma, again, has those two categories, the first being occupational asthma. And this is considered new onset asthma in the workplace that is caused by exposure to either a workplace sensitizer or a workplace irritant. Work-exacerbated asthma, on the other hand, is a pre-existing condition or concurrent condition for someone who already has asthma that is worsened by their work or workplace conditions. Next slide. Here's just kind of a helpful breakdown that was published by the American Thoracic Society, just breaking down the difference between our non-work related asthma, which is your traditional asthma that individuals have, where work-related asthma, again, breaking that down further to the work-exacerbated asthma. Again, those individuals who already have been diagnosed formally with asthma, who have symptoms that get worse when they go to work, and then that occupational asthma, which is an individual who didn't have asthma previously, but due to conditions in the workplace, they develop asthma due to either a sensitizer-induced sensitizer induction or either sensitizer or irritant induced. So what is the difference between sensitizer induced for occupational asthma and irritant induced for occupational asthma? So a sensitizer induced occupational asthma is where a person develops a hypersensitivity or what we know to be an allergy to a substance at work after many repeated exposures, typically over a month to a few years. These are substances that tend to be high molecular weight agents. And so what we mean by high molecular weight is that specifically for proteins and polymers and different occupations, we're looking at something that is going to be greater than 5 kilodaltons is one of the ways that they measure that. These are substances that can cause allergies and are usually found in proteins from plants and animals. These are going to be things like flours and grain that we can see in the baking industry as well as the food industry, latex, when we think of gloves for healthcare workers or individuals who produce products that utilize latex, as well as enzymes. And this is specifically potentially from manufacturing of detergent or pharmaceutical industries as well as food industries. And so we have a variety of things in the workplace that can be considered those higher molecular weight items, animal and animal-derived products as well. So things like dander, hair, those are things that are considered too for laboratory workers, veterinaries, and agricultural workers as well. Next slide. On the other hand, irritant-induced occupational asthma is where a single or a few very high exposures to an irritant substance at work induce the onset of asthma. These low molecular weight agents are going to be the ones that are less than or equal to the 5 kilodaltons. These are chemicals that are easily reactive with other substances and can irritate that respiratory system, leading to asthma. These tend to be more chemical derived and based again. So these are going to be things like our aldehydes, isocyanates that we can find in paints, as well as parasulfites. So things like hairdressers may expose to hair bleaches or dyes. We can also find these in other substances like wood and wood dust, as well as solder fumes for those who are potentially doing welding or working in refineries, things like that. So, what causes work-related asthma? So, we know work-related asthma is caused when working around common materials or substances that can result in the development of that occupational or work-related asthma. There are over 300 known substances that can cause or worsen asthma, and these specific substances we refer to as triggers in the workplace. As far as who is susceptible to developing work-related asthma, anyone can develop work-related asthma or occupational asthma. Some careers do have a higher risk. So careers that do have that higher risk are going to be things like bakers and food processors who have to deal with those flours, grains, coffee. We can also have farmers, millers, or grain elevator workers, again, generated from the dust in those, as well as animal um, hair and dander for workers who deal with animals, so your farmers, laboratory workers, and veterinarians. Then when we have pharmaceutical workers, again, this could be caused by proteins or enzymes in drugs as well as antibiotics. Cosmetology, again, that's going to be things like hair dye or those parasulfites for hair bleach. Some makeup also has those. And then maintenance or cleaning operations, cleaning agents that use chlorine, ammonia, those tend to be ones that could cause work-related asthma exposure. And then also people who work with metals, plastics, or wood. So your welders, carpenters, and individuals in manufacturing or fabrication of plastic goods. As far as the work environment, we have a couple examples to break that down a little bit further. When we're thinking about potential chemical exposure, we are thinking of things like isocyanates, um, as well as the isocyanates, again, those parasulfites. And those are going to be industries that focus on manufacturing things like foam mattresses and upholstery. Again, those cleaning products, hair products, packaging material, plasticizers, and polyurethane paint. Other examples where we have bacterial dusts, mites, and small insects are work environments where we are having farmers, animal handlers, jockeys, and veterinarians. And for small insects, one example that you see noted is cockroach. Um, Cockroaches can leave behind their excrement or fecal matter that can break down, as well as just carcasses. So when you see small insects, cockroaches is one of the main ones we think of for that specific example. Dust from harvesting, storage, or processing of grain and food or other, excuse me, grain, um, as well as things like cereals, coffees, flour, tea. So these are things that we see in work in, as well as textile mills. So this can be things like cotton um, and cotton dust, as well as flax and hemp can relate to the harvesting of this process and lead to work-related asthma as well. When we've referred to metals, the things we're thinking about are things like chromium, nickel sulfite, platinum, as well as different soldering fumes. And again, we traditionally see this in the manufacturers of metals and refineries. Um, but again, really welding shops and fabrications are going to be the most common places where we see this one. And again, the last one we see, depending, is going to be uh, our other work environments. So flavored coffee, um, foam manufacturers and cleaning products, where again, we're going to have that uptick of potential chloride, ammonia for those cleaning products, the plastics when it comes to packaging materials for janitors, again, those cleaning materials, and for foam mattress manufacturing, we're going to see things like those diisocyanates, as well as varnish industry, paint industry, automotive painting, things like that. The last made way we see it is, and again, those proteins are enzymes. And so for proteins, what we're thinking about, as we mentioned, is animal proteins from hair or fur, as well as saliva, urine, and dander. Other times we see this in eggs, milk, and plant proteins, as well as plant proteins from grain, wheat, again, those coffee beans and dust, and, as well as tea and flowers. And for work environments, really, we're looking at food manufacturing for these, as well as animal handling and enzyme detergent manufacturing. And we'll cover an example later on in this presentation. So, what are some indications of work-related asthma, or how do we know we're potentially experiencing symptoms? So, if you go to work and you have symptoms while you're at work, but when you go home or you are away on the weekends or vacation, and those symptoms seem to be getting better, they improve when you're away from work, that can be one indication that potentially this could be work-related asthma, as well as symptoms may appear, after years of working with certain materials. Sometimes they do appear within weeks to a month, but sometimes it does have a latent period or a latent point of onset where many years after exposure, you could develop that sensitivity or that allergy response to a material. So, what are some employee actions that can be done if someone feels like they potentially are experiencing symptoms? Well, they should record the symptoms that they're experiencing. So, when did you first notice that you were experiencing symptoms? Where were you in your workplace or facility when you first noticed those? And what task were you doing? Um, were you potentially dumping bags of flour into um, a batch for baking where using cleaning and disinfectant products in a specific area and noticed that you started to cough and have a runny nose when using those, or have tightness in your chest. So think about, again, when you first noticed those symptoms, where they were, um, where you were when you noticed those, what task you were doing, and then lastly, you want to focus on what specific materials were being used, and if you can locate an SDS for those materials, it can be helpful in determining if it's potentially listed as a respiratory irritant or has been identified as a substance or a material or agent that can cause asthma, which again you can find on an SDS. Identifying those triggers, which are those irritants, allergens, or other conditions, can help with a possible determination of what is causing you to experience symptoms. Once you kind of have all of those items put together, the next step would be to talk to your employer about symptoms you're experiencing at the workplace when you're doing a specific job or task or duty, when you kind of notice those symptoms. And then you can also take that information to your doctor, who can better decide a plan of action or a course of action in connecting you to either to like an occupational health physician or a pulmonologist to see if that connection exists. So, how can work-related asthma be managed? So, employers should work to find ways to avoid or control for different irritants or sensitizers within the workplace. So, NIOSH recommends implementing safety policies, making sure that proper ventilation is in place, but also looking for substitutions for hazardous materials, and then training employees, focusing on hazard communication, how to read an SDS, and alerting employees of what agents in the workplace could potentially be triggers for work-related asthma. Now, there are times that irritants can't be avoided, and if those can't be avoided, respiratory protection or other personal protective equipment could be considered. If the respiratory protection or personal protective equipment doesn't help, then someone could consider job reassignment as well. Other ways that this can be managed, again, contact employee or occupational health if you have concerns about work-related asthma, or consider having a company bring in an industrial hygiene specialist to conduct a workplace assessment or audit. Um, as industrial hygienists, we're trained to review SDSs, have conversations with employees, and try to make connections as to, if there are possible irritants or things that could exacerbate, again, asthma in the workplace, or if there's things that we know could be harmful to employees' health. We're able to monitor and help better assess those situations to determine if there's potentially overexposures or help in identifying other control measures. Workers could also, or employers could also reach out to the NIOSH Health Evaluation Program, or HHE. This program offers free and confidential assistance with identifying workplace asthma triggers. You could also, again, review the common SDSs that you receive when you have products that come in to, again, look for the alerts if it's potentially a respiratory irritant or is known to either trigger or potentially cause asthma. And if you are a workplace that is working with an ingredient or an irritant or sensitizer that is known to potentially cause occupational asthma or lead to exacerbation of um, asthma for other individuals, you can consider adding in a medical surveillance program where you're monitoring the health of the workers working with key agents. If again, you know that this is an ongoing problem or situation within a facility or organization. And lastly, if dust is an issue, one of the things that can be done is powder can be encapsulated or put into a liquid raw material to help reduce the production of dust in an environment. Individuals can also, or organizations can also use a closed system um, for processing and cleaning, making sure that, potentially like flour dust or grade dust isn't spilling over. They can actually have a system that's closed or designed to reduce dust generation. As far as ventilation, we could use things like source capture or local exhaust. You can also use general um, ventilation as well, making sure filters are being changed on a rotating basis, that you're using the proper type of filters um, for what you are trying to, potentially filter out in your ventilation system. You can also work on developing procedures that reduce exposure. So these would be like implementing different safety practices, as well as teaching individuals proper cleaning methods, or potentially looking at using a stream or a damp cloth for cleaning rather than spraying or a strong or misting an area with a cleaning product, spray it directly onto the cloth and then wipe. So just different things that could potentially reduce that exposure. For latex gloves, for example, you could get latex gloves without powder. That could reduce that as well. Additionally, we want to train employees to recognize the hazards and report symptoms. So symptoms could be things like wheezing, shortness of breath, coughing, tightness in the chest, eye watering, uh, runny nose, sneezing. And then we also want to perform preventative maintenance in organizations that do processing of materials that are known to be common irritants or sensitizers. And then we want to be knowledgeable of what potential contractors are using if they're coming into a facility or organization. If it's not something that your organization commonly works with, are they bringing in things that could potentially irritate workers in your space? And now I'm going to pass it over to Anne to cover some real life examples.
Right. Thank you, Kelly. I wanted to go over two workplace examples. For each of these case studies, the citations are in the resource section. For the first one, it involves enzyme detergent manufacturing, and the trigger is known. For the second one, it is a potato processing facility, and the trigger is unknown. Sorry, my multitasking skills are lacking today. So for the enzyme detergent manufacturing, the enzyme proteins are known to have the potential to cause an allergy or asthma. So the detergent manufacturing group got together and they developed occupational hygiene and conducted medical monitoring in order to develop and manage risk. And I want to note that the enzyme detergent occurred in 2015. So this kind of points out that while this is a little dated, it kind of shows you that the whole idea has been around for a while. So when they looked at their raw materials, what they did was they changed the form from a powder to an encapsulated, thus reducing the potential for airborne exposures. When they looked at their equipment and processing design, they decided to implement better local exhaust ventilation. They also looked at the whole ventilation for the facility, and they tried to design their equipment and processing such that it prevented spills, right? So the less spills that occurred, the less exposure that would happen. When they looked at routine and non-routine tasks, they developed safety practices, cleaning methods, and administrative controls in order to get these things under, in order to manage all the potential risks. So when they did qualitative assessments, they basically did JHAs and just kind of understood where potential exposures could occur. And then for the quantitative, they did industrial hygiene sampling to actually determine where those exposures, the highest exposures, were occurring. What they did was they determined sources of exposures and they created countermeasures to prevent those exposures. They also trained all employees on these exposures and the proper countermeasures to them. And what was very important too was they established a preventative maintenance schedule and they followed it, because a lot of exposures occur when equipment breaks down. So if you have a very strong preventative maintenance program, your equipment is less likely to be breaking down and causing that exposure. They also did performance assessments, and they had all employees participate in these performance assessments. And my experience has been that employees who operate machines tend to know that machine better than the person who designed it. So they're really good at understanding how that machine works, what its glitches are, and how to keep it running. Also, when an event did occur, they conducted investigations and they made sure that there were corrective actions and that any follow-up was completed. For the second case study that had the unknown trigger, it was in a food manufacturing facility, and they actually processed potatoes. So it was generated by employees having concerns for chlorine gas, carbon monoxide, and an unknown substance. So being food manufacturing, there's frequent cleaning of large equipment and areas. So the chemicals that were commonly used were carbonate herbicide applied to the stored potatoes. And then throughout the day, floors and machinery were sprayed with several different water-containing disinfectants. They used 2 different chlorinated liquid detergents. They used a phosphoric acid foaming wetting agent. They used a quaternary ammonia disinfectant and sanitizer. They also used a neutral detergent and an acid anionic cleaner. The employee's symptoms involve shortness of breath at work, tightness in the chest, cough, sore throat, eye irritation, and wheeze. Some employees noticed that symptoms worsened after 4 to 6 hours at work and improved 2 to 3 hours after leaving work. So a little bit about this facility. It operates 24 hours a day, 7 days a week. At the time, it had about 850 people working there, and every day about 3 million pounds of potatoes were transported from the climate-controlled bunkers into the plant where they met their destiny. So based on employees' symptoms, when they first sampled, which was back in March of 1999, they collected samples for chlorine gas and carbon monoxide. They didn't find any appreciable levels of these chemicals. However, while they were there sampling, they had quite a few discussions with workers, and based on these informal discussions, they kind of got the idea that the health team got the idea that perhaps these problems might be widespread. Based on the information obtained from these informal interviews, the focus was changed from chemicals to bioaerosols such as bacteria and fungus or their products. So they decided, when they went back in July, they decided to sample for total airborne particles and endotoxins. And endotoxins are the components in the cell walls of gram-negative bacteria. They also created a very detailed health questionnaire that was provided to employees to fill out. So the sampling results from July of 1999, what they found were their dust levels were low. The lowest dust level was below 1 milligram per cubic meter as compared to the OSHA standard, which is 15 milligrams per cubic meter. And they sampled for endotoxins, and even though there's not a health limit for them, they just wanted to get an idea of what the potential exposure was. So when they looked at the data, they split it up into processing and packaging, and they noticed that in processing, they averaged 168 endotoxin units per cubic meter, but in packaging, it was less than the lower limit of detection. So they had a very low limit of endotoxins in packaging and a much higher in processing. When they looked at the health questionnaire results for the employees who indicated that they felt that their symptoms were work-related, 41% indicated they had sinus problems, 35% had a persistent cough, 81% said that their eyes, nose, or throat were irritated when they were at work, and 68.1% indicated that they have tiredness or fatigue. What they ended up doing was they ended up, based on the second set of sampling, they identified the processing area wastewater gutter system that was thought to be the source of the endotoxin. So it was a floor-based gutter system that ran through the area. So what they recommended was that the gutter system be changed so that the time that the water spends in the gutter it isn't as long, and that steam isn't released into the work areas, because it was a floor gutter with grate, so steam could be released up into the work area. They also recommended that they increase the cleaning and maintenance functions of the gutter system, and that in the processing area that they improve the ventilation flow rate through there. They also wanted to note that if they decide to change water usage and they're not using as much, that they don't create another problem, and that airborne potato dust is increased. They wanted to make sure that if recycled water is used, that workers aren't exposed to this recycled water. They recommended that they that they monitor reported health problems and that workers who had respiratory problems were referred to a doctor who was knowledgeable in occupational medicine. And if that occupational doctor reassigned workers with respiratory problems to areas where exposures were lower. We have our resources listed, and they should all be linked for you. And thank you. Kelly, do you have anything to add?
No, if anyone has any questions, please feel free to drop them in the Q&A. Um, Otherwise, thank you so much for joining us to discuss work-related asthma. As always, if you think of questions afterwards, feel free to email us at publicsectorconsulting@slh.wisc.edu, and we can help provide free assistance.